So is there any type of cure for this, or do I have to totally stop exercising?
Let me ask you a question. When you've had the injection, how long did it help for? And did you have a second injection after that?
Yes, I did. I had an injection, and a couple of weeks later, I came to the podiatrist. She gave me another injection.
Good.
She changed the medication, and it worked, I guess, maybe a month. That's if I totally stayed off my feet, besides my daily walking and stuff, but no exercise.
Okay. I talked before about the pyramid of treatment, and the next level of treatment would be things to further help the pain, such as cortisone shots. Now, what cortisone does, it helps decrease the inflammation, but sometimes, in fact, most often, you need to have at least 2 shots, which it sounds like you did. But there's really 2 factors in treating plantar fasciitis. One is getting rid of the pain, and it sounds like your cortisone helped that. But the second factor is controlling the foot and the function of the foot so that the process doesn't continue. And there's something that we use they're called custom orthotic devices, and they are custom made, and you wear them in your shoes. They make them for different types of shoes. For women, there's dress orthotics. For athletes, there's sport orthotics. For golfers, there's golf orthotics. And what it does, it's sort of like eyeglasses for your feet, where it controls the abnormal motion and the abnormal function of your foot, and it promotes proper gait, proper walking, and proper function. And it sounds like you're missing that step. So I'd go back to the podiatrist you were seeing, because it sounds like you're on the right track, and let them know, he or she know, that you're having the problem again, and I bet the next step is to discuss orthotics.
Then the orthotics don't work. Do they prescribe surgery?
You know, again, back to that pyramid, only about 5% of the plantar fasciitis patients really need surgery. And that actually brings us to our topic for today on different types of procedures now that have been developed to actually replace surgery. As I said before, the old surgery was releasing the fascia and removing the spur. And now there are several things that are done that are much less invasive. You are back on your feet much sooner, and you can really resume your activities much quicker than with traditional surgery.
We're going to get to those in a minute. We have a couple more callers. You're our most popular guest so far on Feet Forward. This is amazing.
One of them better not be my kids. I told them not to call.
This is amazing. Let's go. Thank you for your call.
Hi.
Hi, how are you? Welcome to Feet Forward.
Thank you. I have 2 really quick questions.
Okay.
One is I have flat feet. I don't have an arch, and I never, ever wear heels. I always wear flat feet. Is it ideal for me to continue wearing flat shoes? Flat shoes. That's one. And the next question is, I have 3 really big corns on my feet, and I've tried everything over the counter, and to no avail. They're still there. Is it ideal for me to have them surgically removed?
First question, are the corns you're talking about actually on the bottom of the foot, sort of in the middle of the ball of the foot?
No, they're actually on my toes.
On the tops of the toes?
That's correct.
Okay, you have that's called hammer toes. When the toes are crooked, I can this is a good one. It bends fairly nice. I don't know if you can see the bend there, but the toes actually bend and they're contracted, and that's called a hammer toe. And the reason you get the corns is because the toe can no longer move out of the way from the shoe, and it rubs against, it gets irritated, and that is a surgical problem. There's very little to do conservatively. You can try different shoes. If they get inflamed, you can get a cortisone shot, but that problem really needs to be corrected surgically. Flat shoes, ballet slippers, they're terrible for people with flat feet or people with high arches. So the best shoe in a women's dress shoe is either a kitten heel, which gives the look of a high shoe that a lot of women like, or also a shoe that has a little bit of a heel with a wedge. The important thing is to find a shoe with a contoured arch, so you have some contour of your arch.
Okay.
If you are wearing a flat shoe, your muscles are just, they're going to, I'm betting your legs get really tired when you're on your feet a lot.
Yeah.
Yeah, and that's because your muscles are overworking. And flat feet is another reason to use custom orthotics. Orthotics are really preventative medicine for podiatry, and flat feet, unfortunately, which is the most common foot type that we see, really is the ill of all foot problems. It causes a lot of foot problems, including heel pain.
Yeah. Great. Thank you for your call.
Thank you. And
you're welcome.
We have another call? Good evening. You're on Feet Forward.
I know this is going to make some women mad, but here we go. Those flip-flops, I tell my daughter, it don't give you no support, there's no protection, but she said there's comfort. I said they are terrible for feet. And here you two doctors, can you tell my daughter stop with the flip-flop?
Only if you'll tell my daughter first. You know, it's really, really hard to get away from flip-flops nowadays, but there are things you can do in flip-flops that you can purchase that are better than the $5 flip-flops. You want to look for a flip-flop that has somewhat of an arch. You want to have a contour in the sole of the flip-flop. And some of them actually have a deeper cup at the heel where the heel sits. It's not so much cut out, but the heel sits a little bit lower. And those two things give a little bit of stability to the flip-flop. You also want to make sure that the toe thong is of a smooth material and it's not cutting in. And the one rule we have is that in my house is that you don't wear the flip-flops when you are walking a lot. If we go someplace, you're not wearing flip-flops if we're walking a lot. An alternative to flip-flops that are acceptable, especially in Chicago, are Crocs. And there are medical grade Crocs that a lot of podiatrists now carry in their offices. There are many more advantages of Crocs, and you know they're pretty in with the kids still, I think.
Not too ugly. Thank you for your call. I guess she left. That takes care of our callers. What a flurry of calls that time. Just to get back on track, we were talking about general problems that point to plantar fasciitis, and you were about to go into some of the more invasive or more surgical, in some cases, treatments for plantar fasciitis or heel pain. So why don't you pick up where we left off there?
Most heel pain, as I said, is taken care of with conservative measures. The problem arises when you've had heel pain for more than 6 months, 7 months, 8 months, and some people have suffered from heel pain for years.
Yeah.
I had one patient tell me recently she had heel pain for 21 years until she had shockwave treatment. So heel pain changes from being an immediate problem to a more chronic problem, and the tissue changes. So the new treatments now are aimed for that long-term heel pain where the tissue is more dead, actually, degenerative. It doesn't have enough blood flow coming to it, and it needs to be stimulated so it can heal.
Mm-hmm.
So there's two different techniques that are out there. Well, there's a few different things, but two in particular that I've been using. One is called, it's actually a shock wave, and it is a sound wave that gets generated through a machine. It's totally non-invasive. It gets put through to the skin through a gel that helps transmit the shock waves into the skin, and it stimulates healing. I was using that for many years, and now I'm using something similar. It's radio frequency, which is another type of energy that does the same thing. It stimulates the healing of the tissue, and the tissue suddenly has new blood flow, and it responds by healing itself. And both methods are very successful, in fact, more successful than the old-time surgery.
Let's break those down so that the viewers can really understand exactly what they are. Let's start with shockwave. It's sort of like it's almost like an ultrasound, isn't it?
Yeah, it is. It's an actual sound wave. The ultrasound is one sound wave, and we hear a certain sound wave, but some sound waves are therapeutic and used as treatment.
Does the patient feel any pain at all?
There's different types. One type requires anesthesia because it is painful, but that type is usually a one-time treatment. The other type is a low energy and requires multiple treatments, but you don't have to have anesthesia. So there's pros and cons to each, but it's pretty successful. And you need to still control your foot afterwards. There's no athletic activities for at least 4 weeks. No major shopping, no major cooking, but you can go back to your normal day-to-day